Hello, I'm Dr. Patrick Hwu, CEO of Moffitt Cancer Center, and we're here at the 2024 SITC annual meeting in Houston, Texas. And I'm here with Dr. Karol Prieto, who's presenting an abstract on Merkel cell cancer. So,
Yes.
Dr. Prieto, thanks for being with us. And why don't you let us know about your studies in Merkel cell cancer? What is Merkel cell cancer?
Yeah, thank you for having me. We have been working in Merkel cell carcinoma, that is a very rare skin cancer, and then only 3,000 cases are reported every year in the US, and 150 of that cases we have that patients in Moffitt Cancer Center. We have been working in the development of a new mouse model because it's so hard to get a new therapy proposed, because usually the 60% of the patients, they are virus positive. The Merkel is a disease that is driver for the polyomavirus, the Merkel cell polyomavirus, and 60% of the patients are positive. However, the 40% of the patients have virus negative presentation, and they are driver mainly for UV mutations. One of the big problems in Florida is that we have a high exposure to the sun that make this mutation and this virus negative cancer more recurrent in our population. Now we are working in the new model that has 3 different mutations. This is the main drivers, the oncogenic drivers of the virus negative Merkel cell carcinoma, and they are P53, RB mutation, and LMIC mutation. And then we are creating a K14 that is in keratinocytes expression of these 3 mutations to generate a spontaneous model of Merkel cell carcinoma.
Great. And so, to summarize, you said Merkel cell is a very rare kind of cancer,
Yeah.
and it's driven by either a virus, the polyoma virus, or UV sun exposure, and that's the kind of Merkel cell that you're modeling out with the 3 oncogene changes in a mouse model. And so what are you finding from this? Is the immune system important to treat Merkel cell cancer, or how you, what are you finding?
One of the main things that we have been working on is in this, in the development of this immunocompetent model, because before the treatment of the virus positive Merkel cell carcinoma is mainly with checkpoint immunotherapy. However, for the virus negative, the therapy is not working very well with the immunotherapy is not working very well, and then we are trying to find a new target with this new model. We just start with the development of, we started a couple of months ago with the development of the model, and we have really good results. We have new tumors. These animals present tumors very similar to the human Merkel cell characteristic of the, very similar with the patients. And also we now we are starting new immunotherapies, that is our new project with LAG3 and TIM3, and we have a very good results. Most of the animals are responding to the therapy with the different immunocheckpoints in addition to anti-PD-1, because right now the therapy for Merkel cell carcinoma is only based in target therapy or in anti-PD-1 therapy.
I see. So in your model right now, if you add anti-LAG3 or anti-TIM to anti-PD-1, you're getting a better response.
Yeah.
So it's combination immune checkpoint therapy may be what's needed to treat Merkel cell in this situation.
Yes. The most innovative thing of our model is not reported any other virus negative mouse model until now, and then I think we have we are in a good position to find new target therapies, to find new immunotherapies that can modeling a little bit what we are seeing in the patients.
All right. Well, thanks so much for describing your work on Merkel cell cancer and modeling this very rare cancer so that we can find better treatments such as combination immunotherapies.
Yes.
Thank you for being with us today.